I'm Professor Dr. Juneja Dinesh Kumar. I had my MD from Institute of Medical Sciences, BHU Varanasi. At present, I am Professor and HOD of the Department Peaditrics. From today, we are starting a series of lectures on neonatology. Neonates, you all know, up to 28 days the neonatal period is there. Early neonate up to 7 days and late neonate from 8th to 28th days. Neonates are not only important from the theory point of view because you get full questions, multiple short questions, but also from the clinical pediatrics. One short case of the neonate is a certain. Though we usually don't give the abnormal child or the child in emergency condition, most of the times the short case in clinical pediatrics of neonate is a normal neonate. You see, a child has got all the organs, all the tissues as of adult. But can we say the child is a mini adult? Why not? He has got all the organs, all the tissues. Then he should be considered as a mini child. No, it is not. The major difference is the child is in the growing period and adult is not. Child has got different diseases as from adult ones. So the treatment also becomes different. Further, the child has many preventable diseases. We give the vaccines, which are very few what we give in the adult. Now, if we consider neonate you see, has got all the organs as of child. Further, he is same having the growing period as the neonate and the child. But still, can the question be repeated in the same way? Neonate, can it be considered as a child? The answer is big no. Why? See, neonate, though it is in the growing period, but he has got a major maternal antibodies up to 28 days, where the diseases for them we are giving the vaccine are not given in the neonatal period, but they are usually given in the postnatal neonatal period. Further, the neonatal diseases are still different from the child. Most of the diseases which we see in the neonatal period, like RH incompatibility, is different. Further, the congenital anomalies which you just see in the first week or in the neonatal period. Still, there are many other problems, neonatal problems, which are transitional. They don't need any medical or surgical intervention, but they are being watched and observed. Like say physiological jaundice, like say natal tooth. A baby has got a natal tooth. It's not abnormal. Just you have to keep a watch, take care of it. So many problems are there. Subconjunctival hemorrhage, the caput, they are there. They don't need any intervention. Now, the most important question comes, whom you consider it as a normal neonate? You see, if normal delivery is there or the cesarean delivery is there, can we say if it is a cesarean delivery, the baby is not normal, neonate is not normal? Or The weight is 2 kg, that means it is not normal? No. The gestation and the route of delivery has got no value if the gestation is appropriated with the weight. So first criteria is gestation and weight should be appropriate for the gestational age. That means AGA. Second criteria, the anthropometry should be normal. We take 3 major anthropometry measurements: weight, head circumference and length. They should be as per the gestational age. Then vitals should be within normal limits expected for that age and gestation. This, if we can add SpO2, we can add in the vitals. Then you have to see for all the congenital anomalies, are it there? And first important congenital anomaly, what we check is the patency of all orifices, especially the mouth, the trachea esophageal fistula, esophageal atresia, and the imperforatus. We see other orifices also, like urethra, like nose, seen for the choanal atresia, and ear also. Then we have to see this baby, what we have got as a normal neonate. Has he had any significant natal event like the onset of cry? Did the baby cry immediately or it took some time? Did we give any resuscitative measures? Did we give oxygen inhalation? Has the pediatrician been called or the baby has been shifted to the nursery? And if so, then what are the details? Then lastly we see the neonatal problems, which I discuss first as neonate. Can it be considered as a child? Like we have to see the caput, the physiological jaundice, the subconjunctival hemorrhage, and so on and so forth. So congenital anomalies, if we just detail, we can see the orifices one. Second are the digits anomalies like polydactyly, syndactyly, midline defects, meningocele, meningomyelocele, ruptured, anencephaly, encephalocele, omphallocele, then nerve palsies, Erb's palsy, facial palsy, then head anomalies, microcephaly, macrocephaly. Facial anomalies, which can be commonly cleft lip, cleft palate, ear anomalies, microotia, absence of pinna, eye anomalies, cataracts, mongoloid slant, limbs anomalies, osteogenesis imperfecta, achondroplasia, neonatal problems, we should, as I have discussed, we should remember which don't need medical or surgical intervention, like Mongolian spots, different AV hemangiomas, hymenal tract, milia, umbilical hernia, undescended testes, Epstein pulse, natal tooth, caput, subconjunctival hemorrhage, physiological jaundice, transient rashes of newborn. These are very important ones. We should know. So this second part you have seen. First we have seen what are the criteria of a normal neonate, where we have to see gestation and weight appropriation, we have to see anthropometry, we have to see vitals. Then comes a group of congenital anomaly which are to be not present and the neonatal problems which don't need any medical intervention. Then comes the question of the baby is term or preterm. After seeing the birth events, seeing the natal events, we have to now consider the baby as term or preterm. This, though at PG level we see the Ballard scoring, at UG level also we are mainly seeing the physical maturity. And physical maturity is in the term of, first we have to look skin and hair. Skin in preterm is shiny, pink, thin, gelatinous. Hairs are Lenovo hairs, luster. They are very thin hairs. They are not as black as the adult. If you go through the pictures or you see the neonates, you can differentiate. Then we have come to ear cartilage. Ear cartilage, we have to see the whole ear is formed. One. Secondly, if there is any deficiency of cartilage. Thirdly, we have to see the ear recoil. Ear recoil. If you just hold the ear, it should go back normally in term, but in preterm it is delayed. The skin of the cartilage and the ear, it holds. It is almost having the normal recoil. Then comes your breast nodule. You have to hold with two fingers, thumb and the index finger. If you just hold the breast of the newborn, you will see that a nodule is felt. Your fingers never meet each other. This holding is, or the nodule is more than 10 millimeter is considered normal. 5 to 10 millimeter is borderline term, and less than 5 it is a preterm. Then comes the genitals. Genitals, male and female. Male, you will see the penis is well formed, more than 2.5 centimeter. Scrotum is little pendulous. Scrotal rugosities are well seen, which is lacking in the preterm. Preterm skin of the scrotum is shiny, dense, and you don't see any rugosity. In female, you see both the labias are approximating each other. You don't see inside structures, but in preterm you can have a look over that. Sole creases. Sole creases play a very important role. The sole creases in term are either all over the sole or they are over the 1/3. They should be more than anterior 1/3 of the sole. While in preterm, you see the skin is shiny, and even if you see the creases, they are very superficial creases. So finally, again I repeat, when you will say a baby is a normal neonate, first important one is the gestation and weight appropriation, that is AGA. Second, anthropometry should be as per gestational age. Vitals should be as per gestational age. There should be no congenital anomalies. Patency of all orifices should be there. There should be no significant natal event. Those natal events like onset of cry and oxygen inhalation or the nursery transfer should not be there. And whatever the neonatal problems are there, they are the transitional one. Now this all says about a normal newborn. But when you get a newborn, it won't be just in the labor room. It will be either 1 day, 2 days, 3 days, 4 days. And you are being handed over to examine that. So there comes, is there any postnatal events which needs a medical intervention? Like how we can examine the systemic examination. Apparently, you have seen the congenital anomalies, the patency of orifices, the neonatal problem. But systemic examination, to know every system is okay, we can just have the history from the mother in the last 2 or 3 days, whatever old the newborn is. Like you want to see the GIT system is normal, there is no abnormality. You have to ask, the child is accepting feeds, any problem during feeds, passing stool normally, sucking well, any significant vomiting. Regurgitation is a normal phenomenon, but the vomiting should not be there. That needs the just understanding, telling to the mother, the burping and the postural advice when kept on the bed. If you want to look over respiratory system and the CVS system, respiratory system and the CVS system, you have to ask, is the baby pink? Had any time you have observed the bluishness over the peripheries or the lips? Periphery means limbs, peripheries. That means the nails, hands and the toes. The baby is having normal breathing. Do you think he is taking fast breathing or is he taking any voice during the respiration is being heard? This shows the GI respiratory system and the CVS as a normal one. Next comes the nervous system. The nervous system. The baby is active, baby is pink, baby is moving all the 4 limbs. Baby is seeing, watching here and there, all around. This shows probably the nervous system is also normal. So this way you can assess the GIT, the respiratory, the CVS and the nervous system. As far as abdomen is there, you can just have a look. Is there any visible loops of intestine after feeding? Is it looks normal or it is abnormal? So by seeing and observing the baby, you can find out the postnatal events. Now the transitional problem is the baby is having jaundice or the rashes or the transient tachypnea or mild fever. These 4 problems, jaundice, rashes, tachypnea and fever, second day or third day are considered as a transient and they don't need any medical intervention. So finally, seeing that how you will be presenting the baby, you have to say, sir, this 3 days or 4 days baby, male baby of normal delivery or the cesarean delivery is without any significant natal event. He has got all the anthropometry within normal limits, vitals as per the gestation, no apparent congenital anomalies. The baby or the neonate seems to be a normal neonate. So this way you have to present the theory part. You have understood. Unless and until you understand all the theory points, you cannot go for the clinical part. So you have to develop the skill, and the skill is the theoretical skill where you have got time, to think, you have to present, but in clinical you don't have the time. So you should have the whole guidelines when to say a normal neonate. This is the topic today, that what is the meaning of normal neonate, whom we should label it as a normal neonate. I think I have made everything clear. If anyone in doubt, you can come and ask me. You can even ask on my phone number, WhatsApp. I will be replying the questions. But don't hesitate to ask whatever doubts are there. Finally, I must say to all of you for the careful listening, and I like to have your suggestions for further improvement or further way if you want in a different way. Thank you to all of you. Again I say, my phone number is open, and anytime you can ask me questions and I'll be replying. Thank you.